Instagram, Facebook. Welcome. Thanks for coming out today, and I'm answering whatever questions you might have for liposuction, fat transfer. We have this new quick quote system. It's amazing. You guys got to try it out. It's so easy. I've designed this thing myself. It's pretty intuitive. Based off of your height and weight, your BMI measurement is going to give you a generic quote, which will give you a good idea of what our costs are, so you can kind of make your decisions. I know many people are asking about pricing, so we wanted to make this as quick and easy as possible so you can get your answers quickly and make your decisions. Today I thought that it would be kind of cool if I did some of the I went through this process live with an actual person who was interested in doing their quick quote live. And so that would mean I'd have to, if I'm going to need some basic information. I'm going to need your height, your weight, and then we'll go through, and there's going to be a couple choices for you to make. So if you can just stay live with me for a few minutes and answer those questions, we can get the answer for you, and you can get an actual quote right now, live, while we are talking. So, and I apologize, our Spanish speakers, I know you're jumping on here today. I apologize, I don't speak Spanish. Okay. Jen, you said you've been emailing the fast quote, but no response as of yet. Normally, how long does it take? Like, I got caught up on everybody today, so if you did it after noon today, then I haven't gotten to that yet. So yeah, and if you did it yesterday, I got to pretty much, I think I got it to everybody that had done it yesterday. So do we accept care credit? Care credit specifically, we do not accept, but there is a finance company that we utilize for financing. Jen, you did last week. I don't know if I'm sorry, I didn't see your email, and somehow you must have fallen through the cracks. I responded to all of those that I saw, so I apologize. Perhaps if you can go through the system again and request that again, that might be beneficial. And we got to make sure that you have the proper, the name information, the name and email has got to be the same. When you guys interact with our system with multiple, with different names, different emails, the system doesn't recognize you, so it may not create the proper profile for you. And, care information, the name and email. But more importantly, it's like later in the future, we can't pull that data up. So if anybody's interested in doing this quick quote thing, you just gotta put your hands up. I need your height and weight to start with, and we'll go through this process here. Okay, mommy makeover, BBL, breast implants, and lipo on double chin. So we do liposuction. All the patients you see behind us are straight liposuction. We don't do any of the cutting procedures, so you won't get any of the like tummy tucks. We don't do that stuff. We don't do breast implants. We use fat transfer for that process to get you enhancement that way. It's a much more natural approach to this. Our results are much more natural looking. Okay, Miss Hardhead says she wants 360 lipo with BBL. Awesome procedure. I love creating those hourglass figures. Mustang Sally says, is it true that inner thigh fat is the best for fat transfer? I haven't heard that. I certainly haven't seen any studies on that, so I don't know the answer. Okay. All right, so Decimora, I need your height and weight. Okay, here we go. Sari Herrera, what's up from Chicago? You've been wanting to do it, but I'm so nervous. I'm 5'6", 3 kids, weigh 250 pounds.
All right, so we got somebody who's interested.
Yeah, let's do this.
All right. So.
Okay, so this is going to be for Sari. Sari, if you could stick with us for a minute here, we're going to kind of go through this process a little bit for you. This is the quick quote system on our website. Can you put it more towards the middle? Yeah, right there is good.
Size is good enough?
Yes, and it looks like it's backwards.
It is.
Okay.
You turn on the special software.
Okay, Granville's
And
hooking this up so we can see it the right way.
you guys will see magic.
Yeah. I love doing magic.
Yes. Click on that one.
Okay. All right. So we're gonna do one of these live, right? With so this is Sari. We're gonna check her. So the first thing here, she's 250.
250.
5'6".
The
If you guys can see that, Granville's entering that information in there right now. So you can see with this first step here is calculating the BMI. So Sari, your BMI as calculated per the information that you gave us is 40.5. So you'll see, if you look down now in this next section here where it says choose a category based on your BMI, and you'll see that Sari fits into this category 4, which is the BMI of 38 to 44. Now as soon as you click that button, special things open up for you. Now the first thing you're going to see here is need a custom quote. So this is like I wanted this right in the beginning. So if you don't feel like this quick quote system is right for you, you have options. So if you want to click on that yes, we need a custom quote, and you'll see this opens up a couple of options here, and you scroll down a little bit. Now these options, there's 2 different options here. We have this free email quote, and this is a way that you can get human eyes to look at your pictures, and you can write through our form, you can write your situation. So this is best for people that have very simple situations and simple questions. If you have a more complex question, or you're looking for a customized quote, meaning you have custom areas that don't fit into our quick quote system, then you're going to want to do the formal consultation. And so that's the option 2. Now that formal consultation, if you want to speak to me or to Kale, it's $100 for our time. So these are people that, if you're serious, go through the quick quote system. You can get a basic idea of the pricing, so you kind of know where you stand. And then during the formal consultation, we'll delineate a specific quote for you. So let's scroll down a little bit. So now let's say that let's assume that you fit into this quick quote system, and you're going to go through the system. So now you're going to come across the picture section. In the picture section, you'll see this first section here. We show you how we define the 3 sections of the body: the upper body, the midsection, and the lower body. And you'll see how from each angle, I drew on the body the specific area that we would treat for these different package options. Now, my intent with these packages is to treat the entire problem, to maximize the amount of fat that we get out of you, to make the biggest, most dramatic change. And so with the upper body, what I found is the people, especially my larger patients, they have problems with all of these issues. It's not just one of them, it's all of them. So they'll have this double chin, they'll have the arms, they'll have the upper back and the underarm fullness. All of this is included in our our upper body package. Now in the midsection is going to include everything just below the breast line all the way down to that natural fold below your belly into the pubic area. Now larger individuals like Sari, so in this category, since you carry a larger volume of fat, and that's what the BMI defines, it shows the volume, the height of the weight. So we are calculating a larger volume that will need to be removed. So people in this category, we require that they split the 360 lipo into 2 separate procedures. So you can see this is a picture of the front of the abdomen that we would treat. And that's where I would start with everybody. I would suggest starting with the front of the abdomen, get rid of that first. And then we can go to the back side. And you can see in this next picture here, it shows the back side, and it shows how we define and shape the lower back and create the butt. And in the midsection, you can see this is the red lines. The lower body is the blue lines, and that's going to take care of narrowing out the thighs. On larger individuals, you may be a candidate for full thigh liposuction, which actually covers the entire thigh. So you can kind of get an idea with these drawings. Again, this is rudimentary, so have an imagination. You can get an idea of what areas we will be covering with these different sections. So let's scroll down a little bit. So after you've seen some pictures here, our next thing that we want you to look at is these disclosures. So let's open that really quick. Now there's a lot there, and it's just when you go through a system like this, the idea behind the quick quote system is that it was meant to give you an idea of what our pricing is, and it's based on our testing. It seems to work for about 75% of people, and these 75% of people want the same, generic type procedures. And when I say generic, I mean it's the same thing because everybody needs the same issues. When you start gaining weight, they gain weight in all the same areas, so people have the same issues. My intent is to take care of the entire problem, give you big dramatic change, whether it's the upper body, the midsection, or the lower body. So reading these disclosures just lets you know that this quote is not 100% accurate. So in order to move forward with your procedure, we do require a formal consultation. So if you're serious, that formal consultation is necessary. I want to speak with all my patients. So this is the thing is I really want to implement that is I need to speak with everybody to make sure that we're all on the same page. Everybody's happy and understands what we're trying to do here. And also I want to make sure that we're a good fit. So the formal consultation is important. If you like the quick quote, you like the price, everything looks good to you, the next step is a formal consultation. So don't get so hung up on everything with these quick quotes. The formal consultation is the end all be all. Now the next section is the video section. When you click on this, it opens up and you'll see when Granville scrolls down, there's a whole bunch of videos here. And these are like our frequently asked questions. And as you click on each of these videos, the videos will pop up and so you can see. So let's click on one of them just so people can kind of get an idea. So he clicked on benefits of liposuction. And as he clicked on that, you see it scrolls down and you show this is a picture of me talking talking about the benefits of liposuction. And if you scroll back up, you can unclick that and the video will disappear. Okay, so let's scroll down. Now, I highly recommend you watch all the videos. There's quite a bit of content there, so it may take you some time, but if you're really serious about this, you're gonna get some very, very valuable information. So next section is the pricing section. Now, in order for the pricing to work, we got.
I don't see
There you go, open.
open.
You don't see it?
No.
Go. It's lined up with the buttons on the video section. Over to the right a little bit.
Is it here?
That's it.
There you go. Thank you.
Okay, so we got the pricing section. So again, as soon as you click that, it opens up. It's a pretty cool format here where we have this. It's intuitive. So based on your selections, it'll open up and show you different things. Now, the first thing that's really important is we need to get your name, your phone number, your email, your identifying information. So when you submit this form, this will link to your profile that we have in our system, so we know that you've gotten a quote, and we will be able to know exactly what you've chosen. So then, when you call us for the formal consultation, we can discuss specifically what you chose. And so let's scroll down a little bit. Now, the first part of the pricing section is we're going to make our selection, whether we want our upper body, the midsection, or our lower body. So let's, it's most common, I think, is the midsection, but let's see if Sari, which section are you interested in treating? Okay. So everybody's putting in their stuff. I'm a little behind here. So I apologize. Sari Herrera. Okay. So Sari, which section were you looking to treat? Yes, she's probably answered. Stomach. Okay, so midsection. Okay, so on a person of your size, with your BMI of 40, we would expect that you're carrying an abundance of fat in the front. So this would be the bellies that start to hang, and with gravity, we'll start pulling it down and sagging more. So we really focus primarily on the front of the abdomen here to get everything And I see you have our other picture. You want to pop that up real quick so we can see? So this is the front of the abdomen here. Will it go in the front?
This one will not go in the front. Hey,
Okay. Well, so Sari, for someone like you, the recommendation is to treat the front of the abdomen first. And I'm trying to show something. No, it's not going to show the TV screen. So treat the front of the abdomen first. Now, for this size, this is a very large procedure, and we would always recommend that you look at the video specifically for the large volume liposuction risks and complications. So that is something that we direct you to. And to treat the front of the abdomen for someone in your weight category, the front of the abdomen is $10,000. And the area which we would cover is going to be just below the breast line. So if you lift up your breast, you're going to get a natural endpoint, just under your breast. And then we'll go all the way down below the fold of the stomach into the pubic area. People who have large bellies at this BMI level will almost inevitably have a fullness in their pubic area. So we are going to go into the pubic area to clean out everything in the front of the abdomen. And the intent is to get rid of that fold. And if we can completely eliminate that fold or substantially reduce it, that's the goal of this type of procedure. Now, when we remove this, the skin will retract back. It's just a question of how well. Everybody's a little bit different, so it's going to be a little bit unique. Now, if you scroll down a little bit here, there's the options for add-on options, and these are, there's 3 basic options here. In this circumstance, we're doing it's already included Smart Lipo in all the areas of the abdomen, so that is obsolete as far as the first option. The second option is you're doing fat transfer to the breast or the butt. And Sari, in this situation, I'd recommend that we don't do any fat transfer to keep things safe. This is a big procedure already. And the recovery house, which may be a good option for you, especially if you're coming from out of state. We have a recovery house available. It's $1,250 for that, and it's a 3-night stay. So if you're interested in the recovery house, the total will put you at $11,250. Without the recovery house, the total is $10,000. And again, this is a large volume liposuction. We're going to be getting a tremendous amount of fat off the front of that belly. Now, once you've gotten a quick quote and you got your price and everything, you're going to want to hit the submit button, and you want to make sure, again, you have the proper identifying information of your name, phone number, email. This will tag your profile in our system, so we have that for future reference. It also will automatically email you the information that you've chosen for this quick quote. So there you go, Sari. I hope that was made sense to you. Let's see if you guys have any other questions here. I'm all zoomed in, so I got to on my face. Zoom back out. Okay. All right. Was that clear? And does anybody do you have any specific questions? Okay. All right. So Ramirez Paula says, I have a question. I went to another doctor and he told me that he could not operate on me because of my weight. Is this true? Ramirez, that's their opinion, right? But I don't think because of your weight, it's the issue. It's because of the health. When we do any of these procedures, it's not the weight isn't. Now, obviously, there's going to be some limiting factor. Like if you're telling me you're 500-600 pounds, that's going to be a limiting factor. Our beds only hold, I believe it's 350 pounds. So if you're heavier, and that's the reason, that's one story. But if it's for just the weight isn't necessarily a limiting factor. So if you're under the limit for our tables, then we should be able to help you. But the limiting factor is more so your health. And so we would do medical clearance to make sure that you're healthy. Sandra, will the skin be really loose? You can see all these pictures behind us are no tummy tuck. The skin retracts back quite nicely. It's pretty amazing. Sari asks where we're located. We're in the Las Vegas area. Now, as far as the skin tightening, we do use a Smart Lipo laser, which gets you up to 57% more skin tightening than the liposuction alone. See, Maggie You have a question. You have a hernia at the belly button. Can you still get lipo and fat transfers? So hernias that are non-surgical cases, meaning they're not protruding through on a regular basis, we can do liposuction. If it sticks out all the time, then that typically it needs to be repaired before we do the procedure. And there's special techniques. I mean, it's not rocket science here. It's literally a hernia is like a hole in the muscle in your bowels or whatever starts to pooch out. So the treatment for this is literally depending on how big that hole is. If I can stick my finger in it, that protects everything. I stick my finger in there and I make sure with 1,000% certainty that everything stays below the muscle. Then I can kind of go around that. So that's my technique. It's pretty simple. It's pretty easy. Makes sense if you think about it. All right, Sari. So I hope that answered all your questions. And did that, did you understand that? And does that make sense? Okay, definitely be in context too. Awesome. So Sari, you should go through that yourself. Make sure that you put your information in there yourself, because we didn't do that for you. And that way it'll show up in our system. Okay, Mustang Sally says, if we lose more weight to lower BMI before our scheduled surgery date, does the price go down when we show up? Do we get credit towards the next procedure? Well, that's an interesting thing, Mustang Sally, because what if you gain weight, or what if you didn't tell us the proper measurements, beforehand, and you move up in a category. So each of these situations, like I don't want to. I'm not like 100%, cut the line and that's the way it is. However, if we feel like it's not safe to do the procedures, that's really the more thing that I'm concerned about. But if you lose a substantial amount of weight, maybe it'll change pricing. Honestly, I haven't thought about that. So we're gonna have to cross that bridge when we get there and figure that out. So don't take my word just because I said on this live. Don't post this video and say Trevor said, because I don't like when people do that. That makes me upset. Okay, do you guys have treatments for lower back? Yeah, so our lower back, the waist treatment. So if you're larger, and you'd have to split between the front and the back, it's the front of the abdomen is one option, then the waist is what we call it. It covers the rest of it, and the waist is going to create that hourglass figure. It's going to shape and define the butt by taking out and creating that arch to the lower back. That's probably one of my favorite procedures. And I priced it, pretty low, so I'm hoping people will take advantage of that because that's fun for me. Okay, Margarita Perez, how much? Go get your quick quote. I just did the live one. If you missed that, go back and watch the rerun, I guess they call it. And so you too can go get your quote like immediately right now while we're talking. You can go in there and do this quick quote. It's so easy. I went through the process with you guys. You can look at pictures of people that are your size. It auto populates based on the BMI. It's so cool the way this thing works. All the selections are auto populated based off of your selections. It's intuitive. It's a smart form. It's awesome. I hope you guys like it. Worked really hard on it. Will all the tests be done on the same day, or would we have to plan to go twice before the procedure? So Sandra, the labs that will be drawn up to 2 weeks prior to the procedure, sometimes up to a month prior to the procedure. If we're concerned about labs not being good, we want to get them sooner than later. If we get them sooner, we can adjust and do things. For example, like if you're anemic, meaning your blood levels are low, we can do specific things to boost your blood levels to get you prepared for the procedure without any delays. Also, if you have issues with your diabetes, perhaps, you got to get that under control. So there's different lab values that we are concerned about. So the sooner you get it, the better. Okay. Jessica Suarez, can you get a consult, please? So I just did the quick quote live. So I don't want to redo that again right now. If you didn't get that, please go watch the replay of this. It's a good chunk of time I spent on that, and we actually showed the video of the screen, so it took you step by step. So The quick quote's really simple. Anybody can do it. You can get your quote instant. Like, it's so quick. But I do want to push people to make sure you're watching those videos. I did those specifically to inform you. It's really important that you're informed throughout this whole process. The more information you have, the easier it is to make these decisions. Okay, Vero says, I call you today and they said they can give you a quote that you have to go and pay $100 first appointment. Well, so the $100 is for a conversation with me directly. So if you want this like generic thing over the email, is very like, look, we're just gonna look at pictures, you're gonna say a couple words and say, I want this, and we're gonna give you a quote. If you don't fit into our quick quote system, that's not gonna work. If you need a customized quote, like say you had a tummy tuck or you had some other procedure, or you only want a portion done, or you want some stuff that doesn't fit into our generic platform, if you need that, then you need customized help, and you need, you pay $100. It's our time. We can't see. Here was the problem, and this is the reason why we started the whole quick quote system, is that we had a lot of people just asking and wanted individual time, whether it was a phone call, reviewing the pictures, asking all these questions, and we got inundated with so many people, and we were doing this for free, and it's never free. It costs me an employee's time and my own time, and there's a cost to these things. So we can't just give out all of our time for free. Now the quick quote is automated. It's a computer. I can give that for free all day long, no problem. You get your quote, and it's good for, I'd say, about 75% of the people. But if you don't fit into that 75% of the people, you need more help, then you need human help, and you got to pay for that. My time is valuable, and I can't just give it away for free. So that's what it's for. No tummy tucks. That's absolutely our belief. We don't do any tummy tucks. None of the pictures behind us are cutting. Okay, Beverly Miller says, you are so talented. I would love to have my sagging belly gone, but I will just have to admire your work you do for others. Well, someday will be your day. Brittany Eason says, I'm really interested. Can't wait to set consultation. Can't wait to get the body snatched. Nice. All right, I think I've been neglecting my Instagram following. Sorry, guys. Okay. I got a couple people. I know that there was a lot of people that put their height and weight on there. And I don't mind going through that whole process again if you guys want me to go through that process. But it's really easy, and just go in there and get this stuff. To be honest with you, it's all generic. Without seeing pictures of you, it's generic. I can't give you any specific information. It's a generic quote based off of people your size, like general size, right? So just realize the limitations of this type of system. However, it's freaking amazing that you can get a quote it's going to be pretty darn accurate. And I'm not like penny pinching here, and I'm not like nitpicking. It's a flat base price. Like, this is what it is. And when we do our formal consultation, it's just a matter of confirming everything, that everything fits into place, that you didn't put the wrong information in there, that your picture fits the BMI that you claim to be. Because I'll tell you what, there's some people that, man, it doesn't fit at all. It doesn't look right. So there's some people that just simply don't fit into the system, and we got to do what we got to do. But ultimately, it's about safety for the people, and that's really where it comes down to. I'm really more concerned about quoting people at like a lower rate, and then not actually being able to do as much liposuction as they want to do, because they carry their weight the wrong way, or not the wrong way, but they carry their weight. Sometimes if you carry all your weight in the midsection, there's only so much fat that we can safely remove, that your body will allow us to move. Because what we're finding is that as we push the limits further and further beyond, you see these amazing pictures, right? We push the limits further and further beyond what is believed as possible, and we get these incredible, amazing results. However, what we're finding is that there's some risk. There's a risk involved, right? And the risk falls onto the patient. So you guys got to know this stuff. I'm willing to take risks for you, but you got to understand the risks that you're getting into, because we can get these amazing results, but there's a price to pay, and it's not just financial. It's you pay with your body. You're going to have a recovery time. You're going to be more swollen, more bruised. All that comes with the territory, and you got to just be well informed. Okay, pretty JC. I wanted to get lipo, but I had a phone consultation with the doctor and he was disrespectful, rude. Okay. Well, that was me, and I'm sorry if I was disrespectful, rude, and had no empathy. Um, I've had people say I'm an asshole sometimes, but I can be super nice and super loving and caring, and maybe you caught me on a bad day, so I'm sorry. Okay, can I make my lipo with high blood pressure? So high blood pressure is definitely going to be benefited from liposuction. So in removing that large volume of fat, the studies have shown that you can actually reduce the blood pressure, and so that's a benefit. Now, for the procedure itself, it's important to have the blood pressure under control. So higher blood pressure will make you more prone and susceptible to bleeding during the procedure. And also having like a stroke during the procedure. So there's bad things that can happen from it, so we don't want it. And if you're not normally controlled with blood pressure medication, then we may need to hold off on the procedure to get that blood pressure under control. And at the date of the procedure, if you take your normal blood pressure medication and it's still not controlled, we do have the alternative. We have blood pressure medication on hand to assist with that and bring you back into a normal range. Okay, what's the difference between lipo and smart lipo? Interesting question, right? It's deceptive. Smart lipo is just a brand name of lasers, and this is a brand name of lasers which we utilize to tighten the skin. So if you have loose skin, we use the laser, the Smart Lipo laser, to tighten the skin. And that's included in many of our packages, not on all of the areas, but it's included in the areas that are most prone to sagging. Whereas liposuction, in contrast, liposuction is the physical removal of fat, and Smart Lipo is a brand of laser. So I know it's deceptive with the name Smart Lipo, but it is just a brand, just like Coca-Cola is a brand of soda. Yes, midsection, Jen. All right. I know I neglected you guys, and you guys are asking multiple questions. Okay, can you do fat transfer to 2 places in 1 visit? So this is a philosophical question that I don't think is a good idea. Now, theoretically, it is possible to transfer fat to all over the body. However, the fat transfer area, the recommendations after the procedure is to put no pressure on the area for no pressure for 2 weeks and limited pressure for 2 months. So now think about how you sleep. If you got fat transfer to your butt, you can't sleep on your back. So now you're talking about sleeping on your stomach. And if you got fat transfer to the breast, you can't sleep on the stomach. So now you're talking about sleeping on your sides. Now, the sides, what if the fat transfer to the butt, we went a little bit wider over the hip area? And because a lot of girls like to have that wider butt. And so that means you can't sleep on the sides either. So now you're talking about sleeping standing up, which theoretically is possible. And I think, there may be other alternatives if you utilize pillows to, support yourself. And basically you're trying to keep the compression off of the breast or compression off the butt. And you can utilize pillows to do that. So I know it's possible. And I like to push the limits, but it may be not in your best interest. It may be too difficult, but it depends on what your motivation is and how, what you're willing to do, what price you're willing to pay for that, those kind of results to get both things done at the same time. Okay, yes, please resubmit your quick quote. And so just so you guys are aware, those quick quotes, nobody's getting back to you with those. Those are for you. It will go into our system. So if you decide to move forward and get the next step, and the next step would be getting that paid consultation. So where you speak to me directly. So before you get your actual procedure, you're going to speak to me directly. So we are on the same page with everything. So I want to speak to all of my patients directly. And clearly I can't speak to everybody who does these quick quotes. We've already had 500 people that have gone through this quick quote, and clearly I can't speak to all those people. So the ones that are serious, that's the ones that pay the $100 to get their consultation for me to speak with them before the procedure. Where's the location? We are located in Las Vegas area. Quick flight from anywhere. How low does your BMI need to be for round 2 of BBL and Lipo 360? So it's we don't limit you on the BMI. The BMI is used for categorization and pricing, not for limiting. With that said, there are the larger people. So the people that are off our scale, as far as our categorization, when you're 40, when your BMI is 45 plus, these people don't fit into our system because there's a lot more variables to consider with their situation, and we want to discuss with these people directly, as opposed to giving quotes for things that's completely inaccurate. So if your BMI is 45 plus, get the consultation. We can help you. Obviously, we help very large patients. We can help you, but we got to figure out something that's going to work right for you, and ultimately you got to keep it safe for you, and that's where the how should we say, like the imagination. We need to kind of imagine a way to keep things safe while we can get enough fat off of you to make the big dramatic change that you want, but also keep you safe to where we're not going to have any health issues. All right. My BMI is a 34. I want BBL lipo 360 with inner thighs. Yeah, so that's not going to happen. I think in the 34, if I'm correct, is that in the category 3?
Let me go check.
So category 3, most of these individuals carry an abundance of weight on the front of the abdomen, a large enough volume to where it's pushing the limits, and it would be really putting you at the health risk to try to do all the way around the 360. And this is, look, we're looking at the volume of fat that we are going to remove, as well as the amount of numbing fluid that we need to use to get that fat out of there. There's 2 separate limiting factors there. And look, if you push the limits, which I will push the limits. Trust me, I push the limits. However, if you push the limits too far, all the consequences fall on the patient. I'm gonna be there to answer phone calls for you and guide you through the process, but all of the health consequences that happen from pushing limits, they fall on the patient. So you guys need to be well informed of what you're getting yourself into. The results are freaking amazing, but the journey to get there is not simple. It's not easy.
She said she was category 4?
It was a BMI of 34.
34, okay.
That's section 3, right?
30, yeah, 34 is category 3.
So I'm pretty sure in section 3, our recommendations that we split the 360 lipo in 2 separate procedures, which also means that not only can you not do the 360 in one procedure, you can't do 360 and fat transfer and inner thighs. I mean, look, your health is way more important to me than it is to you, apparently. And I'm not saying that it kind of trying to like make you guys realize, like, wake up and realize that this stuff is serious. There's serious consequences to these things, and you can't put yourself at risk. And just because I'm saying I'm not going to do it doesn't mean go to the guy that says he will do it, because there's people out there that will do it and put your life at risk. And there's consequences, and those are the stories that you hear that hit the news. Those are the people that go to Mexico and have problems, or go to Colombia and have problems. I'm here to keep you safe and to get these amazing results. Okay, can you get fat transfer? I think I already answered that. Okay, so the one with the abdomen and the 360 waist, that has to be done in 2 procedures on the instant quote. So that is only for certain categories. So if you are a larger individual, like this individual here, we required her to do the front of the abdomen first, and then come back and do the backside, or we call it the waist, to complete the 360. So if you are large to where you carry an abundance of fat on the front, so again, remember, we are limited on the amount of fat that we can remove. So if you're bigger, we need to remove a lot of fat. And you want us to remove a lot of fat. And I'm not going to tell you, hey, you know what? We got to our limit, we had to stop, so that's why the results suck. I don't do that. And that's why we make these procedures the right size to where I can go to town and get everything out of there and not be limited. I don't want to be limited. And I hope that you don't want to be limited either. So that's what I'm trying to go for. And that's why we make these rules. And I'm not trying to like whatever, there's nothing malicious at all. This is all good. This is all trying out of love. I want to get the best possible results for you. That's it. All right. My BMI is 28.7. Can I get 360 in the arms? Again, no, we're gonna do the 360 lipo. That's it. Especially, okay, look, the amount of numbing medication that we can utilize on a patient is dependent on their weight. So the heavier you are, the more numbing medication we can use and more fat we can get out. Okay, makes sense? The smaller you are, the less your weight is, less of the numbing fluid we can utilize, and less fat that we can get out safely. Okay, so this is the way this stuff works. So just because you're smaller doesn't mean you can do more. You know, and when you try to push the limits, there's consequences. BMI of 37. We can definitely help you. BMI of 37 is going to put you at that range where you got to get that, you got to split it up. She looks really good, makes a lot of sense. You know, I've been doing this a long time, and you know, I've had a lot of different mindsets and different mentalities about how to make this right. And what's up, Kale? Kale's here to have a little talk before we call it a day here. Okay.
So I was at the clinic, and we were trying to revamp and make sure that all of the grammar on the Spanish section of that quick quote was right. And I was listening to the video, and I heard that somebody said that you were mean, so I figured I'd come over and just kind of even this out, you know, bring a little humility over here, and just let you know that, listen, it's all about your best interest when you come in. We make sure that you have a good experience. It's all about the experience. You know, oftentimes I've joked in the past, I like to meet people face to face. It's hard to do the way we're doing it now, because I like to interview our patients as well and make sure that they're a right candidate for us, because you're gonna jive with us or you're not, okay? And that's just how it is. And I like to see who you are, and if it's gonna be a good fit, we're gonna have a great experience, I promise. If not, then it's okay. There's a lot of clinicians out there that do this stuff. So, but I'm telling you right now, you're gonna have an amazing experience. The results are gonna speak for themselves. So, yeah, that's why I came over. Anyway, plus.
So Mustang Sally says, "Who cares if he's an asshole if he makes you look good?"
Listen, Mustang, I work with this dude every day. Yeah, he can be, absolutely. Yeah, but he can also be very compassionate. So.
I can be everything.
Yeah, you talk to his wife, oh my goodness, I bet she's got some stories.
Full spectrum. I am living the full spectrum of life, the goods, the bads, and the uglies.
For sure. Entonces, bueno, yo quería hablar un poco en español. Bueno, estamos arreglando todas las palabras con a quick quote para que sepas, para que entiendas todo. El proceso que tenemos es muy fácil. Solo tiene que darnos un poco de paciencia para que podamos arreglar todo, ¿ok? Ojalá en algunos días, ¿ok?
So Sandra says, will there be a problem if I need muscle repair? I only want lipo, but might need muscle repair since I had twins. So I've never seen patients that need muscle repair. You know, I know that it's they call it, you know, it's almost like a hernia where you got stretching out of the muscle and the belly bulges out. So if your belly is rounded because of the muscle bulging out, then, you know, perhaps muscle repair is warranted. But if you just have a thick layer of fat, we can get that thick layer of fat off, and it makes your belly flat, and you probably don't need muscle repair.
So as far as the wait time that we like to have in between surgeries, we want to give your body a chance to recuperate a little bit. Trevor's philosophy is 1 month. I like 2 months because it gives that body that extra month to go ahead and that inflammatory process to kind of calm down, and it's a little bit easier. So in between 1 and 2 months for the second procedure that we schedule you for, or, you know, if we're doing the front of the abdomen, for you to come back and complete it, do the love handles, hips, and lower back.
So Veronica, Jessica. Okay, she says, I tried to submit the application and would let me. Is there another way? So first of all, take the information and put it into a separate browser. We've been having issues with the link. Also, if that one didn't work, refresh and start over. And in many cases, that'll work. Look, it's all technology, and I'm really actually quite happy with the way it's been working so far. We haven't had too many things break. Let's knock on wood. But
So Kara Green says she's so excited for her procedure. She was quoted 6 to 8 areas. Kira, you must have gotten part of the old system, okay? And then she questions, is the sculpting of the love handles hips part of it? No. So if you're one of those individuals that unfortunately has the bigger, belly, we get really aggressive with what we can do, and we find that if we just treat that one area and we take it all and we give the skin a chance to come back without going into the sides, it's safer for you and you get better results overall.
Hey, do you have that new picture I sent you today?
Yes, I do. Let me go download it.
So cool thing. Well, it was kind of interesting because I had this previous patient. She's about two months out, and she was one of the people that fits into that category 4. So I'm not sure exactly what her BMI was, but I want to say it's probably about 42. So when this picture comes up, you'll see she's a big girl to begin with, and when she called me, she messaged me, and she was concerned that it's 2 months out and she still has this hard indurated tissue, and it was more so on one side than the other, which left it looking slightly larger. And the thing that really excites me about this whole idea is that the fact that she's 2 months out and she still has this hard indurated tissue, that's the swelling, and the swelling is going to continue to go down, which is going to continue to get better. And when you see these pictures, you'll see that it's already freaking amazing and that it's going to continue to get better.
Yeah, so I mean, the entire inflammatory response takes place over a year, okay? You're going to see the most dramatic changes and response over the first couple of months, 1 to 3, even 3 to 6, and then it kind of like levels out, and the scar tissue has gotten a chance to kind of take hold and remodels by the time you hit 12 months. So it's a process. Just think of it this way, okay? We are absolutely changing your body style and your body habitus, and it's very invasive. So it's going to take a little while, okay? So please don't get the inference that you're going to be able to come here, get liposuction on the front of your abdomen, you're going to be able to go to the beach the next day with a six-pack. It's not going to happen. This is a process, okay? So keep that in mind.
Yeah. So
it's a lady with a tattoo on her.
Yes.
Okay. Yes.
So, I was excited because 2 months out, and she still has quite a bit of healing to go, and the results already looked amazing. And
you can see how profound this really is. This change, it really is. Oftentimes, we get patients calling up, and they're still like, they're thinking, well, why am I not just completely flat? And this is what we're talking about. So she still has this inflammatory response. Believe me when I tell you that we have taken out the fat. Believe me, because while you're there on our table awake, you can look over and you can see it. You can see it come out, and you can quantify how much we get out, okay? So believe me when I tell you it's out. It just, that little overhang is now just inflammatory changes. It's fluids, it's proteins, it's complement, it's whatever the body is doing to fix itself. And with compression and massaging it out, it's gonna go away and eventually flatten out.
Yeah. So the thing that I thought was awesome is she at this point she still has what appears to be a little bit of fold where she had the big fold before. There's a little bit there. However, that's where the swelling is, and that's where she's concerned about, which to me indicates that that's going to go away, which means I think that fold's going to go away completely in time, and maybe that's a year.
So it might take a little bit of time, but yeah, you got to keep in mind too that as your body has this inflammatory process and you're upright, gravity is pulling all of those fluids down, so it's going to collect right down through here. Mm-hmm. So, just the FYI, okay? En español, bueno, los resultados acá son muy profundos, ¿no? Se nota que el estómago está muy grande, pero todavía ella tiene un proceso inflamatorio que está pasando y puede hinchar el estómago hasta que se sanan todo, hasta que el proceso se sucede. Eso puede ser más o menos 1 año, ¿ok? Entonces no te preocupes, todo va a mejorar entre el proceso entero, ¿ok?
I got yours from yesterday too, Kale. You want to show that one?
Oh yeah. So this one, listen, there's clients that come through that are just amazing, where they carry their fat. And this poor girl, she was in her mid-20s, right? And she just had, I don't know what genetic factor or code that she had that said, hey, body, let's store this fat right along this lower back and create this spare tire. And you can see, without the crack, but you can see how this weight on top of this, the lower back pushes down on the buttocks, and it gives it that cottage cheese look, okay? That little, that cellulitic look. But look, in a matter of a couple of hours, we take that out, and look at how smooth that is. And you can tell proportionately, see how big it is here, and so it makes her lats look this size. But once we remove it, look how big her back looks now. So she's gonna come back and get that treated. But this is like, body systems are amazing, and this is why I do this, and this is why I think you do this, because this is the one of the most interesting mediums ever. The body is amazing in what it can do, and sometimes it just does goofy stuff like this, and we're able to help out.
She says it's been photoshopped. Look, we cover up the crack. This is for Facebook, okay? They make us do at least minimal stuff where you're not supposed to show boobs and butts and stuff like that. So we're trying to cover up basic stuff.
Yeah, but no, this is not photoshopped. And then,
Yeah.
and what reason would we have to Photoshop?
Right.
The bottom line is, you don't believe us? I don't care. You don't care. The bottom line is, you don't believe us? It doesn't matter. This girl got some amazing results, and she's super stoked now, and that's all that matters, because we treat each patient as an individual, and that's what we're worried about, meeting their goals and their expectations.
Monica Contreras said, how do I know my BMI? Well, on our quick quote system, the first thing is calculating your BMI. So all you have to do, what you have to know is your height and your weight.
Isn't that such a cool picture for Granville?
It is awesome, right?
It's, you know what, honestly, I find it as a compliment that they think that that's photoshopped.
Yeah, right?
Yeah, that's a good point.
You did a good
That's
job.
a good
Yeah.
point. Yeah.
Jenny Ba Rodriguez says you're 5'7", 236. 2 years ago you lost weight, and now you're down to 175. You think you look thin, but your abdomen looks big and flabby. I actually did a consultation with a young lady just the other day who lost a lot of weight, and she was pretty lean. She had a low BMI, but she still had quite a bit of fat around the midsection. So it really depends on how loose your skin is, and what we plan to do with that. But in removing the fat, the skin always tightens up, and it just depends on the individual how well it tightens up. So you may, depending on what your desires are, you may need or want your skin cut away at some point. That's a choice that you have to make. But our hopes are that you can do the liposuction and get the results without doing the cutting procedures.
Yeah, the only time I've ever seen really bad hanging skin so far are the people that got a gastric bypass or gastric sleeve, and they lost weight very rapidly, and their skin was not able to retract as fast as they were starving their body of nutrients, and their size went down very rapidly. So that creates some saggy skin. But if you give it appropriate time to heal and with appropriate compression, then absolutely it comes back.
Marie, you said that you were waiting for a call. All of our paid consultations have been called. Is that correct?
Yeah.
Yes, all of our paid consultations have been called. If you were one of our old people who were in this free consultation system, we are not doing that anymore. It's been replaced by the quick quote system. So then everybody on that list, everybody who is looking for your free quote, you can get your free quote immediately with this instant quick quote system. So please do that first. And now if you have an idea of what you want to treat and you want to get a customized quote, and set a meeting with Kayla or myself, it's $100 for that consultation, and you'll speak to us directly.
So Lily Lotus Doll says she's from Arizona and she needs us, and she can't wait to hopefully come see us by her birthday in October. Listen, I'm from Arizona as well. Come on up. We do not discriminate as far as states. We're open to everybody.
Yeah. And Marie, if you have questions or concerns, or you're not sure how because I don't know what you're asking about, so if you're not sure, please call our office. The girls are there 9 to 5, Monday through Friday.
Absolutely. And Kira, listen, if you're quoted under the original system, then again, jump on the new system, get your quick quote. if you've already talked to one of us and you had like a formal consultation, I would say I'll go ahead and vouch. Just have one of the girls, make me aware, and I will call you directly, and we'll discuss. If you've already scheduled, and we'll discuss the new pricing. Okay.
Margarita, you said that you're going to do the gastric bypass surgery, and they told you that you should do that first before doing any mommy makeover stuff. So, they give you their opinion. It may or may not have been accurate. So if you want a different opinion, you speak to a different person who has a different background and can offer you different stuff. A person who does tummy tucks, they're going to tell you that you need a tummy tuck. A person that does gastric bypass surgery, they're going to tell you need gastric bypass surgery. Similarly, a person who does liposuction like us, we're going to tell you need liposuction. So you got to take these recommendations with a grain of salt and make a decision based off of the information that you have.
So I think what they're probably inferring, though, is that your body's going to undergo such a profound transformation from the lack of nutrients and starvation state that you're going to undergo.
Why don't you explain that a little bit more? Because I know you said it, but when you do these gastric bypass procedures, what exactly are they doing, and why does it cause starvation, like you're saying?
Okay, so the digestive tract basically starts at the mouth and it goes all the way down to the back door. Okay, as you come down the esophagus, it goes into the stomach first. And a gastric sleeve, if the stomach is a certain size and can hold a certain amount of food, let's say it's, for all intents and purposes, four apples, that size, okay? What they do when they do a gastric sleeve is they restrict the size of the stomach. So now you, instead of being able to eat 4 apples, you can only eat a half of an apple. So, and you get full and you start to throw up. So you have a lack of nutrients. You just can't eat because physically you cannot eat, right? That's what it is. And so by not eating as much, your body goes through the starvation. It does not get as much nutrients and glucose and all of the stuff that you were feeding it ahead of time. So a gastric sleeve is a physical thing that goes around the sleeve. A bypass is where they just bypass the stomach and they put it right into the small intestine. There's some other procedures. There's a restrictive device as well. I mean, there's several procedures, but the idea is the same, okay? It goes through a very profound starvation mode is what happens, and you lose weight very rapidly from all areas, and your skin will sag.
So essentially, you do this big surgery just so your body can't consume the calories. So it's essentially, could you not do the same thing if you just decided not to eat?
You could. If let's just say you jumped on Survivor, right? I don't know if you guys watched one of the last Survivors where they had the all-star crew. They had all these previous contestants. It was a change. Their body habits, when they started this, they all understood that they were going to go through this huge starvation process. So they all engorged before they showed up. And they look, man, those guys look out of shape and really overweight. Why would they do that? But the idea is because their body's going to need those calories in the future as they're in that starvation process. So you could, if you can control your mind, absolutely, you can go through that.
So
but if you could do that, you wouldn't be in that state that you're in,
right,
most times, right?
But that's basically it. When you choose to do these bypass type surgeries, you're basically limiting what you can intake. Basically, if you were able to close your mouth and limit what you intake through your mouth, then you wouldn't need that surgery. Okay. Now, when you do that surgery, now it's over the period of the rest of your life, decades potentially. You're being starved, which means that you need to supplement, and you're going to have other health consequences to doing those type of procedures. Which that's okay for some people. And again, you need to know the information before you make the decision. And if you make the decision and say this is the right thing for me, then good for you.
Yep.
Go do that. Okay. However, if you want to avoid those risks, avoid those complications, and doing the liposuction, we have large patients that get a tremendous amount of fat off their belly and accomplish what they're looking for safely. In the rest of your life, you still are nutrition and you get to eat.
Yeah. So yeah, I mean, listen, it like Trevor said, it is a personal choice. You need to go ahead and talk with, whatever specialists that you have, because some people have inborn metabolism errors, genetic codes that predisposes them to carry an excess weight. So it's not a one size fit all, okay? But that was kind of an amazing intervention that they came out with, and I started noticing it when I was probably in the late 80s, maybe early 90s, when they started doing these procedures. The problem is you can be deficit of nutrients and it can cause some other issues. So, I mean, again, I don't profess to be a professional at it, neither does he, as far as the bariatric side, the GI side of things. But yeah, if you go to one of those specialists, they can tell you all of that side. You come to us, we can tell you what we can do, and then you can make a very educated decision based on what you need.
So Brianna asked about payment plans. There's a credit company that we use, so you can call the office to talk to them about that.
Mustang Sally is always on here, and she's always making comments and stuff, and she's got a question. So we can just not get the lipo, or we can just get the lipo to the areas we choose.
So
the Smart Lipo?
Yeah, so Mustang Sally, you're trying to compare the new system to the old system. And the new system, we're just going to include the Smart Lipo in all the areas that we believe that people are going to get the best results from. So that's the front of the abdomen, the chin, the arms, and inner thighs. It's already included in the package, and all of the ones that we do is already included. So and then we only charge an additional $1,000 if you want it in all the areas. So it's a totally different pricing system. So I know you're trying to compare this stuff, and it's just you're comparing apples to oranges. It's totally different.
So bottom line, Mustang Sally, what we're doing is we're including it in the areas that we think it's going to benefit your cosmetic results and help with the skin retraction. Okay, if you want to do it in all of the other areas, which will benefit, it's just an added charge for the other areas. That's all.
What's up, Pennsylvania? Denise.
Oh, listen to this. So even though Trevor is a horrible guy and his bedside manner might lack, Kira Green says, Dr. Trevor did my consult, or did my quote, and gave me solid advice. So there you go.
Oh, nice guy.
There's your
That's
redeeming
awesome.
quality.
Man, I feel so good now.
Mm-hmm.
Hey, there's a Spanish one here.
Oh,
Lives in California.
Vivo en California y yo quiero una consulta. Bueno, tiene que lograr, ponerte por la página de web de nosotros. My Shape Lipo se llama. Ahí por la página al frente hay un button o un lugar donde se puede click y recibir una consulta presupuesta rápida, ¿ok? Una presupuesta según lo que es el tamaño de su cuerpo, el lugar donde quieres el liposuction y las opciones que tenemos. Puedo lograr una presa breve para que sepas con un poco de cantidad, de sabiduría lo que hacemos y lo que vamos a hacer. Y si estás muy interesante y quieres fijar una consulta con nosotros para andar adelante y fijar una fecha de cirugía, tiene que pagar por un consulta con nosotros y podemos charlar y hablar en cuanto a cuáles son los metas que tienes.
Gabriela Hernandez, I spoke with you earlier today, I believe, on your consultation. She says she doesn't mind paying, just scared of the pain. So Gabriela, I always tell people this, that one person's pain is not your pain, and it's no indication that that you're going to feel anything, because there are people that this is a breeze and like it's so easy for them, and then there's other people that it's not. But just because someone else didn't have a good experience doesn't mean that you're going to have a bad experience. Your experience is different. But I can tell you that a lot of this is a mindset and mentality, and if you're going into it with a negative mindset that you're so scared that you're going to anticipate pain, most of those people in anticipation, they feel more pain.
So McGrew 820 asks a question, do you do BBLs on men? Have you ever done a BBL on a man? So listen,
Yes.
He's probably done a BBL on a man. My experience is I've actually created a pair of breasts on a man. And that was, given where I grew up in a very traditional conservative background. It was very eye-opening, okay? And not in a bad way. It took me off guard when he brought him into the room. Hey man, how's it going? What are we doing today? We're doing liposuction around the midsection. And he goes, oh yeah, and then you're gonna create some breasts for me. And he was a normal guy. He was an engineer, a professional. And he tells me, yeah, I want you to create breasts for me, but I don't want them too big because I want to still do my consulting job. So it was kind of a rare request, but yeah, we absolutely created them for him. And if you've ever worked on an engineer, they are very precise and exact, and it was a little difficult because he kept saying, oh yeah, one more cc here, 3 more there, but yeah, we got through it, and they looked great. And so yes, to answer your question, we do fat transfers on men.
Yeah, I've done a few of those, and it is what it is, and no judgment. It is what it is. Some guys, especially the butts, the guy that I did, he just wanted a bigger butt, and I don't know if vain was the word, but you know. See, Yuri says for something like what Tati's Pro got, how much would it be? Like, so she got full thighs. So if you go to the quick quote, and again, Yuri, I don't know what your size is, but you can go in our quick quote system. You can get the answer for that right now. Just put in your height and weight, and then go down to the lower body section and choose full thighs. And full thighs is all inclusive, is from the groin all the way to the knee, circumferential around the thighs. It's a big procedure.
So blessings, I want to know if you do chin implant surgery. The answer to that is no. What we do is we are very good at sucking fat out of places that where there's unwanted fat, okay? We do not do any cutting. We do not do any skin grafting. We do not do any implants. That's not what we do. We specialize in liposuction, and we've gotten very good at it. In fact, you know, I would put our process and our results up against any plastic surgeons in the countries, just because that's all we do.
I wish they had a competition.
Yeah. Oh, I love it.
Mustang Sally says, okay, so if you guys take out 4 liters of fat, can you transfer at least 1 liter back to each boob? So it doesn't necessarily work out that way, because you have to have the space to inject the fat back into. And if you don't, it's like, you know, imagine the boobs are like a water balloon, and if you have a small water balloon, it's only gonna expand out so far. So if you have a lot of space in the breast, I've had some women, we can put a lot of volume in there. So it might be possible, might not be possible, but if you're looking for the maximum volume, we'll just do the maximum volume for you. And you know, it is what it is.
Listen, you know, a lot of people, you know, I see on these other Facebook groups that are following these other doctors, what have you. I hear the discourse, and they're like, oh my gosh, I want to be just like Kylie Jenner, or I want to be just like so and so. I want to look just like this. Listen, we can do whatever your body allows us to do, right? So if you have space and it's shaped and configured in a certain way, we can add fat to it, and we can add volume to it, and we can create a similar shape. But ultimately, it depends on how your body is structured and how your body reabsorbs the fat and reestablishes a blood supply to those fat cells.
Margarita Perez, they say it was going to help my diabetics. Yeah, so diabetes, removing large volumes of the fat has been shown through studies that all of the diabetic profiles, so like your sugars and your A1C, have benefited from large volumes of fat removal. So it should help. We've had, you know, in real life, we've had patients that reduce the amount of medication and sometimes get off the medication altogether. However, you know, you must check with your doctor before changing your medication. This is not a recommendation of getting off your medication just because you get the procedure. It doesn't work that way. You got to do it the right way, please.
Absolutely. Yeah, and not only diabetes. When I was driving over here, somebody had a question about hypertension. Yeah, so if the body doesn't have to work as hard, if the cardiovascular system, the heart and the blood and all of the veins, if it doesn't have to work as hard and you don't have to stress it out as much, including the lungs, then, you know, it's going to last longer over time. But if you have this big excess of cells that need a blood supply, you know, over time, you're going to run out of time. You're going to die early, and you know, hypertension is going to set in, and it's going to put you at risk for things like strokes, things like heart attacks, you know, arterial diseases, I mean, aortic ruptures, I mean, whatever, right? Same thing with diabetes. You get rid of the fat cells, all of the excess fat cells, we get you on a healthy pathway, and oftentimes people are able to improve their diabetic state, and, you know, under the supervision of their doctor, sometimes they're able to get off their diabetic medications.
Super exciting. Okay, Denise, I have a question. I have a bump on my left butt due to a fall. The doctor said that it would go away, and I'm assuming that it has not. I used to work in orthopedic surgery before my days in liposuction, so I had actually seen that quite a few times. It's a traumatic fall. It's usually due to a hematoma, and the hematomas get some scarring of sorts, and you may have a residual bump there. Removal of that, liposuction may help if it's in a position or an area where removing through liposuction would be beneficial. But if it's on the butt, then you're talking maybe more about adding volume surrounding the area to bring everything out to that same fullness. That might get it to where you're looking better.
So Sin Forgiven said it's still a huge difference at only 2 months out. So I think she was referring to that one picture.
Yeah, that's what I was talking about. It's crazy how
absolutely
crazy.
Huge difference. So thanks for noticing.
Yeah.
And look at this one. This is another one of those probably higher BMIs, okay? And wow, you can barely see her underwear in this picture, in the starting picture, and then in this one, look at this. I mean, she looks like an entire different person, and you can actually see the letters on the sports bra, pink.
Yep.
Pink.
Now she did lose weight. You can see how she put the 230 up above, and then she lost weight to 157. So she had lipo 360, but she also coupled that with the lifestyle changes. And this is a prime example of why I suggest the lifestyle changes are so important after liposuction. If you gain weight after liposuction, you just don't get these kind of results. It is what it is. Okay, Griselda asks how much is for the consult. So the quick quotes are free, and if you're ready to talk to somebody, if you're serious, then it's $100, and you'll speak with myself or Kale.
So Angela Vargas Chi-Town asked if the $100 go towards the consultation, and on Monday, I think, or yesterday, we addressed this and we said yes as of right now, but things are changing, and if you don't get on it, we're going to start making it to where the $100 is just to help subsidize us for our time that we're doing the consultation. Yeah. So right now they are. So you come in, you schedule a consultation for $100. You talk with us, we move forward. It goes towards the cost of your procedure. Yeah, sin forgiven. Yeah, you saw how that, like, absolutely, that weight, relieving that weight up on that lower back, just absolutely smoothed out that butt. It's one of those moments in medicine where you're just like, you feel so blessed that you're able to intervene on somebody's life and help them with their perspective and their perception of their body. I mean, it was just.
Cool. Okay. Can I say something here? This is really cool. So you girls will be able to. You'll be able to understand when you push your thighs together with your hands. So you put your thighs and you push your thighs together, and then you get this dimpling stuff. So this is what she was getting on her butt, and it wasn't because she was pushing anything together. It was simply gravity was pulling down on that fat up above, which bunched everything together and caused the dimples. So as Kayla was saying, when we took out that lower back, it took all the pressure off the butt, and all those dimples disappeared. It's incredible. This is why I tell people, like, you just don't really know what the benefits of liposuction are actually going to be until you get it. And when you get it, you're going to find there's some amazing things that you just didn't even think about. And we didn't think about.
Yeah. So, I mean, every body system is dynamic and unique in its own right. And, a lot of body styles kind of fit into one category, and it turns into a routine for us, and we see them a lot, and so we're able to be very efficient with them. But sometimes you get just abnormalities like this, and these are fun to treat because of who you're working on. It's something different, and then you got to use your creative brain. It's like a 3D art class with this medium, and you're like, okay, well, how is this supposed to sculpt into here, and what should it look like, and how do we want to create it and help her improve her confidence?
It's like a clay block, and we just got to remove the stuff that doesn't belong. And the crazy thing is, I've described it like that before, where people, it's almost like you have this blanket of fat surrounding your body, and all we're doing is we're taking that blanket off in the right proportions, and the shapes are already there for you. Okay, do you do tummy tucks? We do not do tummy tucks. None of the pictures you see behind us are tummy tucks. None of them are the cutting procedures. We're going to be done here in a few minutes, so any more quick questions?
So the question is, if she has a consultation on February 11th, how soon can she have surgery? So February 11th is not very far. The limitations as far as how quick we can schedule you for surgery is obviously openings in our schedule. Our February is booked. March is mostly booked. We're booking into April and May, okay? There are some other limitations as far as we got to make sure that your body is healthy. So we want to run some blood work, basic blood work, some screening labs to make sure that your body's doing what it's supposed to. And once we get all that information back, as well as the paperwork finalized and all of the payments, then, then you're good to go. But once you put down your money and put a deposit down, we set a date, and then we work to making sure that comes to fruition.
There's a question on how soon you get the procedure after consultation. Were you addressing that?
Yep.
Okay.
I'm glad he was paying attention.
Have you ever dealt with a patient who had hidradenitis
suppurativa? Yeah, absolutely. So that is just a cystic inflammatory disease. It can cause cysts in various parts. One of the most debilitating cases I've ever saw was a younger female in her early 20s. She would develop it in her groin in the vaginal area, and she was super self-conscious. She never wanted to put on a bathing suit, never really wanted to go out, and it impeded her intimacy with her partner. So, but yes, we absolutely do that. Typically, it's underneath the armpits is where we do it, is where we see a lot of it in medicine. But if we're working around the midsection, yep, absolutely. Sometimes that can be a hormone issue, so you probably should go to your primary care doctor and get checked out, and there are a lot of medications that can help you with that disease state.
So Yenny asks, how much does it cost to get lipo in the inner thighs? All these answers can be answered like right now. You just go to their quick quote. If you go on our website, myshapelipo.com, the quick quote is the first thing that you're going to see there. Just click the button, go through the system, and you'll be able to get your answer right there.
Yeah, para seguir en español, bueno, no les olvidamos, es que somos gringos y a veces empezamos a hablar en inglés, pero estamos contigo, tenemos un equipo de personas que hablan español y les puede ayudar con sus metas y lo que quieres en cuanto a liposuction. Solo tiene que ir a nuestra página de web y empezar con el primero y llenarlo y sacar una categoría para sacar un presupuesto rápida y después fijar una cita de una consulta de $100 y podemos hablar. Vas a hablar conmigo porque él no habla ni jota de español. Entonces, bueno, hágalo, okay?
So Ash Nicole, she says, I want lipo and fat put in my hips. And I just want to show, this is a nomenclature issue, meaning the words that you're utilizing that I don't think are the same words that I would use. And when you say hips, I think what you mean is more so this outer thigh area, so lower butt. So like if you imagine your butt as an upside down heart, you want to be going into that hourglass figure. And if you add volume up higher here, it squares off the butt and totally messes with the whole the smooth transition of the hourglass figure. So it's you may be talking about the lower wider part of the butt. So this gives you that upside down heart, kind of like Kim Kardashian, and she's a little bit wider towards the base of the butt. If you put that volume up towards the top and what we consider the hips, it squares out the butt and it doesn't look good.
Bueno, eso en español se dice, tengo unas bolsitas en mi pápados. Eso se puede operar. No sé qué es pápados.
Can you look up pápados on
pápados.
Google Translator?
Si hay una persona que habla español que sepa lo que es y qué parte del cuerpo.
P-A-P-A-D-O-S.
Quizás podemos contestar. Bueno, disculpe, no sé todas las partes del cuerpo. Hola doctor, no entiendo mucho del inglés, pero me gusta ver todo lo que hacen. Saludos de Ensenada, Baja California. Bueno, he ido a Ensenada y también ellos se pasan por Ensenada porque siempre, bueno, ellos tienen, bueno, su mamá tiene una casita allá más al sur en la Baja de California. Entonces él se pasa siempre a Ensenada. Entonces, saludos.
I like Baja. I go there often.
Okay, Suso says, I've seen my friend who had this surgery, but she was awake during the procedure and very painful is what she says. So Sue, listen, there's a couple of thoughts with this. This particular procedure was invented so that you could do it safely, and we push the envelopes as far as safety and how much we can get out, okay? So it's important that you're awake this entire procedure because we get really aggressive. Okay, and when I say aggressive, we remove as much fat as your body can tolerate. So you're awake the entire time, absolutely. Okay, is anything in life pain-free? I don't think it is. Okay, so if you're weighing, 220 pounds and you're standing on a 5'6" frame, have a BMI of what? How long is it going to take you? How much blood, sweat, and tears in the gym working out over how much time is that really going to take you? It's probably going to be pretty painful.
That's painful. And even if you don't do anything, how's life when you're 215 pounds and 5'1"? It's painful.
It is.
Just walking's painful. Your knees are painful. Your back's painful. So it's painful no matter what you do. But check out Punk Ass 909, 1 month post-op, and she's down 20 pounds. That's freaking awesome.
So anyway, I was going to finish my thought. Bottom line is, in the matter of like 2.5 hours, right? we can totally change what you've got going on. And is there some discomfort? Absolutely there is. But we've done lots of these procedures, and I'll be honest with you, my favorite demographic is the, that late 40s to like 50s, because they understand what life is about. They understand that there has to be some sort of payment as far as pain, whatever, and they tolerate it well. And if they let us go to work, we absolutely go to work, and we can take out as much fat as we can.
Paparas, it means eyelids.
Eyelids. Oh, no, bueno, eso sería un poco difícil. Me imagino que está refiriéndose de esas pajas, esos papas, esta parte de su cuerpo. Yo creo que necesitaría un blepharoplasty. Yeah. No sacamos grasa de esas partes porque eso es un lugar muy delicado. Okay.
All right. Last question. I had lipo 2 years ago, and my stomach had dips. If I do another lipo, will it make it better? So that's you're talking about revision liposuction, and we do repair mistakes that are made from previous procedures. It is possible to get them smooth. However, there are complications, so you have to understand what the complications are and what the risks are and the limitations are. So I would highly suggest you setting up one of the consultations so I can evaluate the specific situation, look at your pictures, and discuss the options with you.
Okay. Cici says ponen cadera. I think the cadera is por allá. No sé.
This is revision lipo here.
Eso es una revisión. Se puede, bueno, vamos a ir adelante. Mira, ella ha tenido cirugía unos 15 años antes de eso. Y yo podía sacarlo a la revision, a la segunda vez. Siempre nosotros hacemos ese tipo de trabajo porque hay muchas personas que dicen que se pueden hacer liposuction, pero no se hacen un trabajo bueno. Entonces vienen a nosotros para corregir lo que ha pasado y se nota, todo está bien plano y yo podía sacar la grasa y darle los resultados que ella quería.
So the cool thing I wanted to point out with this is that what happened here and why the mistake was made in the first place was the fat was taken out irregularly. So you can see around the midsection on this upper picture here that there was fat that was left around the belly button area, which caused that protrusion, and there also was not enough fat taken out in that lower belly, which allowed it to still hang down. Now, how you solve these problems is fairly simple. It's just take out enough fat evenly all throughout the area, and magically this happens. When I say magically, it's not magic because it happens almost every time when we do the right stuff. You have to be able to do the right stuff to get the right results. And clearly there was some limitation, there was something that stopped them from doing what was necessary to get the proper results. So we can definitely fix situations like this. So get probably I would do the formal consultation, pay for the time to speak with us, and we can give you our opinion.
Yeah, and I said in Spanish, but yeah, we do revisions all of the time because there's a lot of people that profess to be clinicians and do a lot of liposuction, but ultimately what they do is they cause a lot of problems. And revisions are difficult to do. And there was an adage that I heard a long time ago in the girl group that was getting breast implants. And the bottom line is, if you want a good surgeon that can do an amazing breast job, go to the surgeon that does all of the revisions, because he typically has seen the hardest cases and he knows what he's doing. So that's what we do, and that's who we are.
Mariana asked, how do you make the skin, this is the last question, that's it, I know I said that before, this is the last question. How do you make the skin tighten? So there's a couple of things that we do. Number one, we utilize a Smart Lipo laser. The Smart Lipo laser is a laser that we pass underneath the skin at the same time during the liposuction. It heats up the skin, causing a contraction, and stimulates collagen growth for about 6 months after the procedure. In addition, there are specific techniques. And so you can see, I'll zoom in on this picture again, and how we get this skin to tighten up. It's the technique of removal of fat in the proper way that allows for the skin to tighten up. See, fat was left behind that didn't even allow the skin to tighten in the right way. Because it was unevenly taken out. When you get the fat out properly, the skin's allowed to tighten up the way it should. And so our job is just creating the situations that give you the best potential chance for getting awesome results. And that's what we do.
Yeah, Lily Garcia says, thank you. That's exactly how I have my stomach. Yeah, listen, and you may have been one of those persons that had amazing results the first time, and then life happened and you just, collected fat and now it looks just abnormal. That will happen. So either way, we do revisions and we're really good at them. They're really tough, and you need to understand all of the expectations going into it. But yeah, we can do it for you.
All right. Thank you so much for watching. I seriously appreciate you taking the time coming out. And don't forget, go get your quick quote. It's so quick and easy. Don't need any pictures. It's based off your height and weight. Get your quick quote, and you'll know whether it's time. If it's your time to change your life and start your life transformation, then the next step is getting that paid consultation, that formal consultation. So we'll talk to you soon.
Wait. And I just want to throw out here, okay, listen, you guys are watching the video. That means you're somewhat motivated.
Mm-hmm.
But guess what's right around the corner? Summertime.
Yep.
Okay? Tax refunds are coming in. People are going to start spending in the economy. Listen, let's make this year 2022 the best year you've had in 20 years,
Yep.
30 years, whatever it is. Let's change your body. Now's the time. Let's get you chiseled for summer.
It's the start of the rest of your life.
Mm-hmm.
I've been posting this quote recently that every human has 2 lives, and your second life starts as soon as you realize that you actually only have 1 life. Because a lot of us have been fucking shit off for our whole lives and thinking that we have the rest of our life and we're going to be able to live forever. But once you realize that that's not true, this is your only body, you're going to start taking care of it the way you should be taking care of it, and that's when your second life begins. So thank you so much for watching, and I hope you guys stay motivated.